Welcome to another enlightening session on World Autism Day. In this, we will talk about how we can collectively support individuals who are affected by this. Now, to discuss on this knowledge series, we have our guest today. I would like to welcome Dr. Isha Soni. So, Dr. Isha Soni is a center head and senior occupational therapist, having over 12 years of experience. She's a founding member of the Lexicon Rainbow School and Child Development Center. She's a certified sensory integration therapist from the University of Southern California, USA, and a Bachelor of Occupational Therapy from St. G.S. Medical College and KEM Hospital, Mumbai, India. She has been among the university and college toppers during the course of her graduation. She has many additional certifications in the therapeutic techniques and approaches like handwriting without tears, brain gym, decoding autism, social thinking program, and teletherapy practices. She's also an internationally certified play therapist. Welcome, Dr. Isha.
Thank you so much, Aparna. It's a pleasure being on WomenShine.
And we have Dr. Preeti with us. Dr. Preeti wears so many hats. She's a writer, author, blogger, and so many things she's into. She also deals with autistic children and counsels autistic parents. So over to Dr. Preeti.
Thank you, Aparna, for this lovely intro. Well, I am a proud ambassador of the Spectrum Awareness platform, and I am doing my little bit for these autistic children. So it's a pleasure to be here and to be on this platform on Autism Day and having our special guest, Dr. Isha, with us. So without further ado, it's over to Dr. Isha. Dr. Isha, I just want to ask exactly what is ASD and what are the symptoms associated with ASD, or that is autism spectrum disorder, and how can it be diagnosed? First and foremost thing our readers would like to know.
Yes, so ASD, as you said, it's a spectrum disorder, and it is a childhood developmental condition which is diagnosed in early years, typically between 12 months to 18 months. The early sign that the parents or the pediatricians can pick on are, lack of eye contact, not the child not responding to their name, not following the point of the parent or the caregiver. They have delayed speech and language. They do not communicate their day-to-day needs. So these are some very early signs. Also, children who are on the autism spectrum, they show certain sensory sensitivities, or they are either seekers. So there's a lot of running, jumping, or sometimes they are found to be very, very hypersensitive to day-to-day sensory experiences. So for example, nail trimming, hair trimming, or touching even food with their own fingers can be like an upsetting or very overwhelming experience for them. Even play gets interfered because of these sensory processing issues. So the children may refuse to sit on swing, or the child, even like getting down from a small height is a challenge for the child. But if I have to sum it up in layman's term, so autism is basically where the child is lacking in social interaction, communication, may show certain repetitive behaviors like hand flapping or rocking, and has sensory processing issues.
Wonderful. And how do go about with the diagnosis? Can we get an early diagnosis of a child suffering with autism?
Certainly. So when you are going on your routine, vaccination schedules or vaccine visits to your pediatrician, it depends country to country. Many countries, they are now screening autism at the regular pediatric visits also, because the incidence is much higher than what it was before. And as the incidence is higher, the awareness is also much higher if we compare to the last decade. So going to your pediatrician, the pediatrician asking you certain questions and answering them honestly, rather than being in denial that, oh, he's not looking at you, or maybe you are a new person to him, so he's not responding to the name called by you. I think we as parents should be honest enough and answer our pediatrician honestly, so that the early action can be taken on it.
Wonderful. So, if we want the parents to understand, it should be an early detection so that time is not lost for getting it
Exactly.
treated. So,
Yes, yes.
what kind of different challenges does a child, since you said it varies from child to child, what kind of different challenges do children face with with this sort of a disorder? Like,
So, like, there is, as I told, speech and language delay. So the child is not, able to express verbally using expressive language, that, his basic needs and wants. The child may not be able to connect with the people at home, or the child tries to avoid social situations, like, maybe it's just going to a mall, maybe it just be a birthday party, or his cousins have come over home. So the child is kind of isolated, the child is not really looking forward to those social interactions. Or sometimes the child who is a high functioning autism child, the child wants to but doesn't know how. So the social skills are lacking in the child. Many times we see behavior issues in children who have autism. It's because the lack of speech is there. So the child is not able to tell in words that, this is what I want, or I don't want you to do this, or I want you to do this. So then, to get the parents attention, the child may do head banging, pinching, pushing other children. This is a very common scenario in the park. So children who are autistic, some of them, they really want to go and play with the children of their age group, but because of lack of speech and language development, the way they try to get the attention of the another child is maybe just going and tightly hugging the child, such that the other child may get scared, may get surprised by this, or by pushing another children. So this is a very common scenario we get to see. So behavior is one, and sensory processing issues are very, very common in autistic children. So as I told you, they may have certain touch hypersensitivities. They may get upset with the day-to-day auditory stimulation. So maybe it's the cooker whistle or the mixer grinder, or even the classroom is found to be very noisy for children. Some children don't like those sounds. Some of them, they seek a lot of movement and pressure, so they are constantly running, pacing around. Parents sometimes tell us that the child doesn't sit even for a second. So these are the certain issues and challenges due to which the child is not being able to be an active part of the environment or engage socially with their age group or even with the parents.
thank you so much for enlightening us with so much of this. Because, Dr. Isha, is it more prevalent today or compared to earlier years?
Yes, so the prevalence has certainly increased. If we talk about back in 2012, the incidence or the prevalence rate was 1 in 110 child. So one in every 110 children was diagnosed to have autism, whereas now the current rate in India is 1 in 68. So it's like almost kind of doubled. And what the global rates are, so they are 1 in 36. So it
My
is
God.
like, yeah, so that maybe the diagnosis has increased because of increased awareness, because of high literacy rates in parents, because of easy access to medical services. So yes,
Right.
there is a certain increase in awareness, due to which more and more diagnoses are happening. But it's also not the case that they are being overdiagnosed. I mean, nobody would just go and simply diagnose a child to be autistic. So it's both, like, even the prevalence is increasing, and because of increased awareness, we are getting a higher number.
Why do you think it is increasing? Is it because of some environmental factors or some other factors? Do throw some light on it.
So, if we are talking about causes of autism, there is no exact cause that has been pinpointed till date. Research and data are still finding the exact cause. There are many scientists which are working on it. But one certain cause that has come up is the genetic mutation that happens while the embryo is being formed. And also there are certain environmental causative factors as well. So we have seen an increase in numbers post pandemic, where the children had lack of social stimulation. They were totally confined in their houses, or they were exposed to a lot of screen. So because both the parents were working, how the child has to be kept busy. So this is about the pandemic. But otherwise also, when we are taking history from parents, when a child is coming to us for therapy, we are getting really really high history of the 6 to 7 hours of screen time being shown to children as young as 7 months old and 8 months old. So, excessive screen time is not the exact cause for autism, but a child who is more vulnerable, who is carrying these autistic genes, it is worsening and exacerbating the symptoms all the more. So it is causing further delay, more behavior issues. And it's like you are taking therapy but exposing your child to a lot of screen. So it's like opposite of each other. As much as efforts are being taken for therapy, the screen is like kind of washing away the excessive screen time. So there are research and data which is proved this also, that children who are undergoing therapy for autism should be kept away from screen, because the effects of therapy and the excessive screen time are not are like they work in opposite direction to each other.
Okay. So does therapy help, and how much therapy is required per child? Is it different, and what kind of therapy is there?
Yes, so early intervention is the key when it comes to autism spectrum disorder. And in early intervention, the services that are usually referred are occupational therapy. So in occupational therapy, the occupational therapist works on the fine motor, gross motor skills of the child, as well as sensory processing difficulties of the child. We just spoke about sensory issues. So, an occupational therapist works on that. Speech and language pathologists will help to develop the communication in the child, develop the expressive language in the child. Also, the speech therapist will help for non-verbal communication also, like use of certain gestures, because it's not like you start speech therapy and immediately within a month your child starts talking. So it is very important, even in our day-to-day life, we all use and understand non-verbal gestures. So a speech therapist works on that. Then there is behavior therapy, in which the parents are counseled about how to tackle negative behaviors of the child. Or it is always very well said that a behavior is through a behavior a child is trying to communicate something. So for the parents to understand what the child is trying to say, how to fade negative behaviors, how to encourage positive behaviors. So this is how the behavior therapy works for autistic children. And then there is remedial education. Many times children who are on the autism spectrum, so they do not learn through the conventional methods of teaching. It is said that autistic children are usually more visual learners, or they are kinesthetic learners. So a remedial educator customizes the program according to the child's style of learning, and teaches the child the academic concepts accordingly. And yeah, so now why are therapies useful? So it is said that autism is a lifelong condition, and many parents say that why should we do therapies when there is no cure to it. So it is because by doing these therapies, we are helping the child to attain the milestones in which the child is showing a delay. If we don't do therapy, the child is not going to, outgrow it, or it's not like, one fine day magic will happen. So by doing these therapies, the child will learn how to express his needs and wants. Because of that, the frustration will go down of the parents as well as the child. The mental health of the entire family will improve, because the child and the parents both are able to understand each other. Because if the sensory processing issues are settled of the child, they are able to engage more with the environment. Like, they are able to lead more normal life, like going to a mall, going to a birthday party, going to a wedding. The child being able to go to a regular school. If the social skills are taught to the child, and if the hyperactivity is reduced by taking these therapies, a child is even able to attend a regular school. So there are many,
Okay.
many, many benefits. And even as we spoke about the behavior modification, if the behaviors are also, if negative behaviors go down of the child becomes more inclusive in the environment. So these are the impact that the therapies has on an autistic child. And answering your question about how many therapies are required, so this differs case to case, because as we told, autism is a spectrum condition. It affects each child differently. So for some child, socially the child is good, but there is no speech in the child, or sometimes the motor skills of the child are more affected, or the child has speech but has a lot of social behaviors. So that way the domains of autism affects differently in every child. And that's how and when a therapist will decide how many sessions are required, and how often, and which therapy.
Great. I mean, you've enlightened us, and most of the parents whose child is suffering would know a lot what Dr. Isha has already told us. Now, since we were talking of inclusion, can children who are autistic be included in a regular scenario, school scenario? Can they attend a school where children are normal, or we have to have special schools for them?
So, as I told you, every autistic child is different. And by this, I also mean that the level of support each child requires is different. So, there are some children who are very, very raw. So, by raw, I mean that, they have maybe a lot of behavior issues. They are still very much engrossed into themselves. They're not able to connect with the people around them, or they do not have the the required language and speech to connect with them. So in these early years, what we usually recommend to parents is that, let the child go to a facility where your child is understood, and where there are experts who can handle your child and can facilitate effective communication or social experiences for your child. So this may be the case where, a child is attending special school, or a child is attending child development centers. Many times we also get to see milder cases of autism. So by mild, I mean that the child is very much social. The child has speech and language in place, but there are certain social cues which the child misses in, or the child is academically lacking somewhere. So this kind of children, they can attend to regular schools, but they also require external therapies, and they require some in school support. So by a counselor, by a special educator, or in collaboration with the therapist that the child is seeing, effective accommodations can be made in the classroom. Like, frequent movement breaks can be given, or the curriculum can be a bit diluted for the child. The way of assessing the child can be different. So it depends, again, child to child. But yes, there are many children who are able to go to regular schools, and who are able to follow regular curriculums also.
Okay, wonderful. Some children, like on the spectrum, are quite gifted. So, how can one help these children out with these hobbies? Do they require some special assistance, or one can normally manage in the house?
So, as you said, some children are gifted. So these are called as, savant abilities. So, some children are very, very expert at mathematical calculations. Some children are very good at, constructional things. Some children are very good at art. So it depends on the parent and the therapist to identify this skill in the child and hone it further. So for that, whatever extra support or classes are required, the child can join that. I must say, many children, many clients in the past who have been taking therapy from me have done beautifully in music. They are able to recreate the same notes and the same rhythm what is there in a song. So many of these children, they have received formal musical training, they pursue professional courses, and they are able to make a career out of it. So I think it's the early identification which a parent must do, and then further polish these skills for making a productive career out of it. And there are also many organizations which support, or there are many multinational companies who are practicing and promoting diversity and inclusion, and they are giving employment to autistic adolescents or adults.
Wonderful. Another question which comes to my mind is, since we were talking about children, once they reach their teenage years, as you know, every teen is ravished by those hormones, and these hormones which ravish them, they might be affecting these autistic children. So how is it possible to explain these kind of body changes or the mood changes to a autistic child?
Yes, so this is a very common question which the parents start thinking about as soon as the child is approaching age 9, 10, 11. So yes, autistic children do have sexual feelings. It's not that they do not have it, and they do hit puberty. It does happen that they are experiencing a lot of aggression due to the bodily changes, both internal and physical characteristics that start appearing around puberty. So, early education of children by the parents or a trustworthy person will help. So, knowing your body, what are the changes that are going to happen. So the social stories, they work fantastic with children. Usually autistic children, they don't like surprises.